Everyone back to school yesterday. That was the big theme of yesterday. But the National Education, Health and Allied Workers Union, that's Nehawu, say healthcare workers in the country are eagerly awaiting the start of the inoculation process. Nehawu also says that the overall morale among healthcare workers has been very low since the outbreak of the pandemic, but the prospect of getting vaccinated gives them hope. President Cyril Ramaphosa said in his statement on the State of the Nation address that the first phase of our vaccination program, which is targeted at health and other frontline workers, will now use the Johnson & Johnson vaccine, which has shown to be effective against the 501Y.V2 variant. That, of course, the variant that was found here in South Africa. Zola Saphetha, the General Secretary of Nehawu, joins us to talk a little bit more about this. Zola, good to have you on the show. Welcome.
Good morning, Eliane, and the viewers.
So I imagine there was a bit of disappointment with the slight delay that we saw. Firstly, thinking AstraZeneca was the way that we were going to go. Some say 1.5 million doses arriving in the country, but then seeing that the efficacy was not good enough. And now it's the move to Johnson & Johnson. How are the healthcare workers feeling at this point?
Yes, they were quite disappointed and also lost the hope that there might never be any kind of an intervention. But with a recent announcement that Johnson & Johnson is making as an intervention on the AD26 COVID-2, that brought hope once again, because this one, there's no doubt it has been trialed in South Africa. About 6,576 South Africans have been subjected to this, and it's quite clear that it's responding to our 501Y.V2.
So we talk about the fact that the people are very excited about the Johnson & Johnson vaccine that is set to arrive sometime this week. Some are saying tomorrow, some are saying they don't know, but it has been pinpointed that this week is the week that it'll arrive. Do you have any idea as to when it will arrive, when the rollout will take place? Perhaps you're privy to more info than we are. Zola, are you? We seem to have just lost Zola there. The connection not too good. We've lost him a little bit there, but we're talking about the healthcare workers and obviously their excitement ahead of the rollout for the vaccine here in South Africa. We gave you a little bit of the background. AstraZeneca was the preferred choice for the healthcare workers. It was found that it had a 22% efficacy rate, and it was not the recommended choice, especially for the new variant that has appeared to be the dominant strain here in South Africa. So that's something that we, I suppose, have put on the back burner for now. And now there's the talk about wanting to send the vaccines that we have from AstraZeneca back to the Serum Institute. But there's still negotiations ongoing there because they do expire in April, and that's a big worry. However, it's Johnson & Johnson now that the spotlight is turned to, and it's finding out exactly when it will be arriving in South Africa. Some saying tomorrow, but I'm still awaiting confirmation on that just to find out if it is going to be happening tomorrow and when the rollout will take place. But we're trying to get back Zola back on the line. As soon as we do, we'll chat to him. But let's